Hello and welcome to part 2 of this subcutaneous fluid administration demonstration. I'm Dr. Wendy Brooks, owner of the Vista Animal Medical Center and the Educational Director of VeterinaryPartner.com. This is Michael, our volunteer, who will be receiving subcutaneous fluids today. So first, let's double check our setup. Alright, so here we have our drip set. It's hanging, so we have gravity to assist us. We have a fresh needle on the end of the line, and make sure you're standing where you can see the drip chamber, because we're going to need to see the drips flowing through the drip chamber. Make sure that there's enough air in the drip chamber that there are actually going to be drips. If in the course of storage the drip chamber becomes filled with fluid, simply invert the chamber and give it a squeeze to get some air in it, and turn it back right side up again. The fluid line has bubbles in it, so one last thing we'll need to do is clear the bubbles from the line. To do this, uncap the needle and open the line. Fluid will be flushed through the line and the bubbles will be flushed away. We should now be ready for the patient. Here is our patient. For most patients, fluid administration is a one-person job, but having a second pair of hands is a well-appreciated luxury. We want to stick the needle in an area where it will hurt the least, and where there's plenty of room for the fluids, and that means the scruff of the neck. I'm going to lift up the scruff, and you'll see a triangle form right here. That's where we're going to put the needle. It's important not to be shy. If you're too slow, it will hurt more, and if you don't get the needle all the way in, you're going to get fluids all over the fur and make a big mess. So what you need to do is take the needle and quickly stick it in there. Okay, so here we go. Okay, I'll take the needle. Notice I'm holding the patient with one hand. And here's the needle. We're going to stick it in right quick. And I've got him with one hand. With the other hand, I'm going to open the drip set. You notice there's a pretty brisk drip in the drip chamber. If while you're performing this procedure the drip rate stops or slows down, you can simply change the angle of the needle in the patient, or if necessary actually insert the needle over again to get your brisk drip back. A hump of fluid will form under the skin. When the correct amount of fluids has run in, as shown by the demarcations on the bag, then you're finished. When you're finished, simply close the drip set and pull the needle out. It's normal for some moisture to be present on the fur as the fluid leaks out the needle hole. Be sure the fluid has been absorbed before it is time for the next fluid administration. The fluid may have dropped around the neck due to gravity, so be sure to check around the entire area. Do not give more fluid if the pet has not absorbed the last dose. Do not be intimidated by the spray of fluid from a needle. If the patient escapes during fluid administration, you will see and feel the fluid spray from the needle. If the needle goes sideways and actually comes out the skin of the other side of the patient or doesn't penetrate all the way, you will feel and see the spray of the needle. Do not be intimidated. If this happens, simply close the drip set and start over. You may need to recap the needle, but don't be afraid to manipulate the drip set. As you become more comfortable working with the drip set, this procedure will become easier and easier. I think we've covered everything you need to know to give subcutaneous fluids to your pet. If you have further questions, be sure to bring them to your regular veterinarian. You should also be able to schedule lessons in person with your hospital's veterinary staff if you feel you need to.